This is the formal expression of a pivot away from the COVID-centric focus that public health has been forced to take on for the last 4 years by dint of necessity.
I'm going to say welcome to all of you to a new era of public health in Seattle, King County. This is exciting. So if I could just get everybody to be really excited, say good morning, and say, yes, let's do this.
Yes.
Nice. Okay, I want to make sure you were following the instructions. I am so excited about this because this is such an opportunity to be the lighthouse, the North Star of what is necessary for communities across King County. And that is what this strategic plan is all about. It's a 5-year strategic plan. I've had a chance to go through the plan. Dr. Khan made sure that I went through it. He sent it to me in advance. He said, make sure you read this. So he's very good about making sure that I am very well prepped. And I will tell you what I'm most impressed by is not just the fact that it calls out racism, it calls out challenges of equity, it calls out community concerns, it calls out the public health issues, infectious diseases or chronic diseases or environmental health or climate. But what it does is it says, how do we come together? How do we come together by reminding ourselves it's about data and science, but it doesn't stop with data and science. That is the basis, but we must do more. We must be beyond that. It's about how do we tell the story of health in our communities.
Good morning, everyone, and welcome to Public Health's Strategic Plan launch event. This is an exciting day as Public Health sets the course for the next 5 years. 5 years to tackle challenges to our community's health. Now, we understand how critical it is to chart a path forward, but also how capable we are of even as we pursue that course, taking on challenges that suddenly and maybe unexpectedly appear. Right Center, Teresa Mosqueda, Councilmember Mosqueda.
I want to share in the excitement for the opportunity to be here to celebrate public health. There is nothing that gets me more excited than talking about health, social determinants of health, and how we codify our commitment to embedding public policy through the lens of health to actually further our not just individual health or family health, but population health. And I think I'm in the right crowd to celebrate public health. This is really a wonderful opportunity to be here to not only celebrate the future and the vision of what public health will be in King County, but really to take a moment to celebrate all that public health has been able to accomplish. We are on the national stage because of the work that Executive Constantine, the Public Health Department, the leaders and workers within public health have done prior to the pandemic, but especially during the pandemic. We were one of the first areas in the region, in the nation, to get hit by COVID. And everyone was looking at you. And the way the executive responded and the department responded and the way the workers on the front line responded made an example for the rest of the nation to follow. We had some of the better health outcomes and some of the fastest responses because of the workers and the way in which you deployed the resources around this region. You showed not just the nation, but the world how we can respond to a pandemic and come out stronger and better and more resilient. So thank you for your work on public health, always, especially for COVID. Thank you to the workers who put yourselves and your family's health on the line every day. And thank you for the work you continue to do today. For this item, number 1, workforce, and you all making the infrastructure possible, thank you. Let's give it up for the public health team.
Matias, Valenzuela, the Director of the Office of Equity and Community Partnerships with Public Health, Seattle and King County. Today we've been celebrating the launch of our Public Health Strategic Plan. It's a 5-year strategic plan that comes on the heels of COVID-19, the pandemic, and our declaration of racism as a public health crisis. We have a lot of lessons learned, and we also have some new emerging threats, climate and many others around violence, mental health, overdose prevention. We have worked very hard with our community partners during the last years, but especially also around the strategic planning process. We have co-created with them, brought them in the fold from the very beginning, and worked through the details of the plan. They're going to be holding us accountable to make sure that we follow through and are able to deliver the things that we are doing. We're faced with a lot of challenges, but today is also a day just to celebrate the fact that we've been able to get past the pandemic, the worst of the pandemic, have had some relatively good outcomes compared to the rest of the country, but there's so much work to be done, especially addressing systemic racism and the impacts on health. So we're just very pleased to be able to bring together such a large group of people to come together, because we need to do this in a collaborative way across different sectors. So with that, I'm going to hand it over to our Community Health Board leader here, Yordanos.
Thank you. Hello, my name is Yordanos Teferi. I'm co-chair of the Community Health Board Coalition. Honored to be here today. It's a wonderful celebration. I'll keep my remarks brief since I spoke, but happy to have been part of the co-creation process for the strategic plan. And I think a highlight for me today is to see our public health leaders not only steward the strategic planning process, in which we love seeing commitments that are geared towards health equity and anti-racism, but to also allow for the celebration to take place in which folks are voicing those commitments in such a beautiful way. And with that, I'll pass my word to Elsa.
Thank you. My name is Elsa Batres Boni. I'm the director of Communities of Opportunity, an initiative of King County and the Seattle Foundation. And I am here to celebrate what public health is doing, which is launching their strategic plan. And what I'm here to, not just representing what communities interested in hearing, which is that public health is not just about health the way we think about it traditionally, but it's all about what our communities need to thrive and to move forward. What I love about today was what they said about that this is the first time that we're moving from just thinking about the pandemic and COVID, but what are the other issues that are affecting our communities? And that, of course, if racism and equity is being on the front line, then we want to be here to see how can we partner and support. And so thank you for engaging us in this conversation. We need to be paying attention to what public health is going to be doing. So thank you.
Thank you for listening. Please make sure to share, like, and subscribe to Runta News channel on YouTube, Facebook, and Twitter.